Hi, I'm Santina. I am Dr. Demestri's PA, and today I'm going to discuss drain care. So most times patients will have drains either in their breast or their abdomen, and so this is just a little care guide here. So this is an example of a drain out of the body. This noodle end here goes into the cavity, so either the breast or the abdomen, and it is sutured into the skin with a black suture. And a lot of patients sometimes feel as though they're having shooting pain or nerve pain, any sharpness that they may be experiencing, and that is due to the stitch and the nerve and that kind of tugging. Gabapentin can be super helpful to relieve some of that tugging as well that you may experience. So the drain is sutured in, there's no way for it to fall out. And this tube end here drains into this drain bulb, okay? So ideally, when we're doing the stripping of the drains, which I will demonstrate, you wanna make sure that the bulb is on suction. So you wanna squeeze the bulb and clamp it. It may not hold suction because there's nothing in the pocket, but this is what you want the bulb to look like, okay? So as we're unclamping it, then you empty it, measure it out, and record. So it's super important to keep track of your drain logs. Depending on how much the drains are putting out will depend on when they come out. So every surgeon is different with their protocols. Per Dr. Demestri, it's less than 25 cc's in a 24-hour period for 2 consecutive days, and the drain can be removed. If a drain is in a pocket, let's say 2 drains per the abdomen, 2 drains per the breast, we'll never remove both drains at the same time. It just puts you at too much risk for seroma and hematoma, which we'll talk about in another video. The last thing I will demonstrate is how to strip the drain properly. So this guy here is in the body, and this is what's left hanging out. So what you wanna do is use one hand here to hold pressure, and I'm gonna just taper down here. And then what you'll do is you'll hold on tight here, and then just pull and pull and pull and pull. And that gets any clot or any chunks that are in the drain down into the bulb, just to clear the tubing out so that it can drain the pocket appropriately. So that is the proper way to strip a drain. After you strip, then again, you'll put the drain on suction, and there you go.